Hello everyone. I am Dr. Rakesh Sharma, consultant Uro-Oncologist at Basavatarakam Indo-American Cancer Hospital and Research Institute. March is a month of Kidney Cancer Awareness Month. So here I would like to inform the general population kidney cancer, the related risk factors, and the precautions which need to be taken to treat and diagnose it early for a better outcomes of kidney cancer. Kidney cancer is 13th most commonly diagnosed cancer in the world amongst all the cancers of the general body sites. And in India also it ranks 20th for the one of the most common cancers of all the common sites of body. The risk factors associated with kidney cancers are generally tobacco smoking, alcohol consumption, some environmental factors, obesity. So people who smoke or chew tobacco, they have almost like 20 to 30% higher chances of developing kidney cancers compared to the general population. Obese people who have a body mass index, we call it as BMI, which is more than 25 to 30, has a higher incidence of developing kidney cancers. Similarly, there are some chemical agents, people who work in factories, they are more prone to develop kidney cancers. Also, it has been noticed that men have 2 times higher incidence of developing kidney cancers compared to women. Also, hypertension, which is a very common problem in our population, also has been related with kidney cancer. There is almost like 15-20% higher incidence of kidney cancer in population who have hypertension. Diabetes mellitus also has been associated. Chronic kidney disease patients who have renal failure, they are also higher incidence of developing kidney cancers. There are some genetically associated kidney cancers, which is called as the von Hippel-Lindau disease, where there is a problem in the genes, the chromosomes, which can lead to early development of cancers. These are the patients who present with kidney cancers at an early age, somewhere around 25 to 40 years. So if your family member, your father, mother, brother, sister had kidney cancer at an early age, you also should get yourself screened for the genetic testing. Also, there are other syndromes which are not very common, but still, if the family member had cancers at an early age or bilateral cancers, the other family members need to get screened. So, how does generally a kidney cancer present? So, kidney cancer, the most common presentation is a palpable or a mass which is felt on the abdomen on any of the sides. They can, when it is presented at little later stages, they present with bleeding in the urine, they present with loss of weight, loss of appetite, pain in the abdomen. These are the common symptoms. But over the past 2 to 3 decades, there has been a trend shift in the early diagnosis of kidney cancer because of the profound availability of investigations in the form of ultrasound and CT scan, which is even available in the smaller cities, district places, where ultrasound, a simple ultrasound can diagnose a kidney cancer at a very early stage. That's called stage 1, stage 2, where the treatment can give a complete cure. So early diagnosis is the main answer to treat the kidney cancer. So with latest advanced technologies like the robotic systems, we can do surgery for those small tumors and only remove the tumor that is generally in the stage 1, and save the rest of the kidney and prevent the patient from developing a chronic kidney disease or called as a renal failure or dialysis dependent. So we can do small keyhole surgery with the robot and save a good part of the kidney and prevent the patient from developing renal failure. That can happen in stage 1. In stage 2, more often than not, we have to remove the kidney completely because the kidney, the mass is little bigger. So after the CT scan diagnosis, the patient undergoes a laparoscopy or a robotic operation and the kidney is removed completely. Similarly, in stage 3 also, we have to remove the kidney completely because already the mass of the kidney tumor has gone outside the kidney fat. So we have to remove the kidney completely. And in stage 4, the mass has already spread into other surrounding organs like the lungs, the liver, lymph nodes, occasionally to the bones and brain, where the survival or the outcome of the cancer is not there. So Early diagnosis gives you almost beyond 95 to 99% cure and more than 10 years plus survival rate. The next is, what are the other treatment options? There are some minimally invasive other techniques, what is called as a radio frequency ablation, the HIFUs, which can be used for ablating the tumors for patients who don't want to undergo robotic surgery. From outside only with small probes, you can burn that tumor completely and you need not require any surgery. But generally, they are referred for patients who are little elderly. They are not fit for any operations. Okay. In stage 4, the main part of the treatment is called as the immunotherapy or the targeted therapy, which has given good overall survival benefits to these patients. So, talking about the prevention, so you can prevent yourself from developing kidney cancers mainly by stopping or not taking those harmful things like the tobacco, the smoking, alcohol. If you are a hypertensive, try and keep your BP under control, take your medications regularly. If you are diabetic, get your sugars under control. If you are already a renal failure patient or a chronic kidney disease patient, get yourself regularly evaluated with your nephrologist because you have a higher incidence of developing kidney cancers. If you're working in some chemical factories, get yourself checked at regular intervals because you are at higher incidence of developing kidney cancers than the general population. If you are obese, you do some exercises and try and get your BMI at least around 18 to 20, which prevents you from developing kidney cancer. Talking about how to get yourself diagnosed at an early stage so that you can have higher chances of getting cured, we recommend every individual to get themselves an annual health checkup after the age of around 40 to 50, which includes a basic evaluation with a kidney function test and ultrasound and X-ray, which helps you diagnose these cancers at early stage and get yourself cured completely. So let's follow this month of March, the Kidney Cancer Awareness Month, educate ourselves, prevent from all the chances of developing cancer, and get yourself diagnosed at an early stage to get the best cure and best treatment. Take care. Thank you very much.